Okay, so we're here with Lauren Slive, the co-founder of Project Heal and MedPLUS Connect. I guess first of all, how did you first become aware of this issue?
Well, when I was in college, one of my good friends was on a scholarship at the University of North Carolina, and that scholarship enabled her to travel to Ghana, and she was really able to witness firsthand some of the issues there. And she was working primarily in schools and orphanages, and one thing that she saw was that a lot of times kids in schools would get these kind of little cuts and scrapes that we would just wash off here, put some Neosporin on, put a Band-Aid on, and we'd be fine. But there, because people didn't have those supplies or know exactly what to do, a lot of times these little cuts and scrapes would turn into really big infections, could even send kids to the hospital. And so she started kind of anecdotally doing a little bit of education to the parents, and she came back and we started talking about it and kind of realized that, we're not doctors, we're young, we don't have any kind of professional training, but we probably had enough knowledge and resources to be able to try and put some first aid education together.
I'm wondering, what was your initial vision for the project? What did you think you could accomplish when you first started out?
We didn't really have a huge vision or anything for the project when we first started out. I mean, we just wanted to use the resources and the context that we had to try and see if we could help a little bit in just a small way. And I think that was really important, just sort of starting small, because we didn't get overwhelmed as easily, and we felt like what we were able to do is really tangible. Bringing suitcases of medical supplies is pretty small scale, and we were able to focus our efforts in one area of Ghana to begin with. And so I think that really helped.
I'm just wondering, you're this 20-year-old kid, and you get to Ghana for the first time with this suitcase of medical supplies. What was going through your mind when you first got off the plane into this country where you don't speak the language? What was going through your mind at that moment?
I think I was just really soaking it all in. It was incredible. You read about the way people live in other parts of the world in textbooks, or maybe you watch it on TV, but it's so different when you're there experiencing it for yourself. Just put a lot of things in perspective for me, and was also an incredible cultural experience to be able to get to know people there so well and still have great friendships with them. But yeah, getting off the plane, I think I was maybe just overwhelmed with all the sights and the sounds and the smells. And
one of the things I found so interesting about MedPlus Connect is you took this idea, made it into a nonprofit that's 100% financially sustainable.
Yeah, it was really, really important for us not to be based solely on philanthropy. We wanted our organization to be sustainable, because we saw, like in the economic downturn, how a lot of charities suffered because a lot of the philanthropic giving kind of slowed down, and we were nervous, and we didn't want that to happen to us. We wanted to, we were making a commitment to these communities in Ghana, and we were scared that if we were just based on philanthropy, that we wouldn't be able to have them rely on us, and we didn't want that. So our model is basically such that the Ghanaian Ministry of Health pays us a fee for every 40-foot container of medical supplies we ship. That covers the warehouse costs for storing the supplies and packing them, MedWish International. And then we have a small surcharge on top of that helps cover our administrative costs. So that's how it works. So we have like a flat fee for each of the shipments that we charge. And then that way, the Ministry of Health can dictate what their needs are, and we work closely with them and the recipient hospitals to figure out who would be best to receive the containers.
I mean, you were pretty young when you started volunteering and going into activism and things like that. I'm wondering, what made you decide to take all these problems that you were learning about in the abstract and, decide to take action?
I can't really think of like a point in time or some kind of shift or some kind of thought. I think it was just being brought up especially in a family and in a school system that where conversations about the world were really fostered. Mm-hmm. Because I felt like I spent some time in high school in Model United Nations club, and so just learning about global issues, I think, just made me much more aware of what was going on outside of sort of my little bubble growing up in the suburbs and right. Playing with my friends. And my parents were always very supportive, and my teachers and friends, their parents were always very supportive. So mm-hmm. I think that was great. If I had an idea, I felt like I could run with it and people would be supportive.
You mentioned the support you got from your family, and actually, I read that your mom helped you establish the group as a nonprofit legally. I'm wondering.
Yeah.
I mean, did your parents ever did they ever express nervousness or anxiety about what their daughter was doing, or were they always so supportive?
Um, I think they were very supportive of everything I was doing in the United States. When it came time for me
Right.
to
Yeah.
go to Ghana, that was when I sensed that first amount of hesitation in my mother. And, she knew it would be very expensive. And so I think that she said something along the lines of, well, if you can raise enough money, then you can go,
Okay.
kind of thinking that I wouldn't really be able to raise enough money in time. And
Right.
then when I did, the horror in her voice, I remember what I told her was unmistakable.
The problems that you're trying to tackle here are such large systemic issues that have plagued society for centuries. When you were starting out, did you need to convince yourself that these were things that you could in fact change? I mean, was it ever overwhelming at all?
I never really think that I thought about it in that way in terms of systemic problems. I mean, I knew that they were systemic in the abstract, but when I was doing it, it was more connected to a specific community or a specific recipient. And I think that was really all the encouragement and support that I needed. When we started out shipping to this one village in Ghana called Laura, we had established such amazing relationships with with the people that lived there and worked there. So everything that I was doing, I felt like was for Laura. That's really how I see it. I mean, I hope that someday the aggregate of the work that I help with and the work that other people do can all kind of come together and contribute to systemic change. But I think for me not to be overwhelmed, I have to look at it in terms of reaching out to this one community and trying to make a change there, and then trying to replicate that, trying to make it sustainable.
Right. I'm wondering, what was the biggest obstacle that you faced trying to get Project Heal off the ground? I mean, there are so many things that go into it, but was there something that really challenged you that you had to overcome in the process of it?
I think one of the biggest things was really the responsibility of taking other students to Ghana, to a developing country, was probably one of our biggest concerns, because we just really felt responsible for them. And just as my parents were worried, other people's parents were very worried. And so, and when we were in Ghana the whole time, I felt so responsible for everyone, wanting to make sure that they were happy and comfortable and safe all the time. And, a lot of the other things that I expected to be difficult, like raising money, weren't as hard, because UNC really was dedicated to fostering this type of experience for students and student ideas. And so we felt so much support there. It was really incredible.
I'm just wondering, as someone who's been a young person who was able to affect change in society, what would your advice be to someone who might be troubled by problems they learn about in the abstract, but are intimidated either by the scale of the problem or their youth or anything like that?
I guess I would say start small, pick something tangible that you feel that you can really accomplish, and nothing is too small to start with, and then look out for people who are going to support you, because none of this can be done alone. Find friends, teachers, parents, family friends, or other, organizations that support youth. And just remember that starting small is really how most things start. And, the MedPLUS sends millions of dollars worth of medical supplies, but just a handful of years ago, we were dragging suitcases of Band-Aids through customs. And I never thought that we would be at a place where we were sending 40-foot containers many times a year to recipient hospitals. It just sort of grew organically. And so I think just starting small with something that you feel like you can really accomplish is the best way to get something off the ground. If someone has the means to be able to travel to a developing country and sort of witness firsthand what's going on, I think that is just the most incredible impact. I mean, I know just seeing it firsthand has completely changed my life and completely changed my perspective. And so I think that is a great service to yourself to do, to broaden really your world perspective. And I think can also inspire a lot more action and a lot more change.